Yep. Now we'll start our third session on MPS 006 disaster medicine. So, so far we had covered the first 8 units. The first unit covers generally about everything about disaster medicine, epidemiological studies. Now, that is also important part of health management. Then prevention of risk. But here we are talking about the uh, disaster medicine risk. Then medical preparedness plan. Logistics is another important part. Remote area planning. By remote area, what do you mean? Anybody? What do you understand by remote?
That is the plan that should be done at the ground of the disaster. That is the place where
No, what
disaster
is
occurred.
remote area?
Okay, remote area. That is the area is going to be disconnected from the rest of the distance as a result of the disaster occurrence.
Okay, good. Very nice. Um, See, remote area is something which is disasters generally become remote area. Yeah, Abdullah, what do you want to say?
Yes, what I want to add is that when we are talking about remote area, we are talking about villages and small towns that are not advanced in terms of infrastructure and utilities. So
Okay.
remote area is villages that are difficult to assess in terms of
Yeah.
or during disasters.
So
Yes.
yes, rightly said. Um, Remote areas are areas which are difficult to access. Uh, it could be villages. Some villages may not be remote. There may be some villages may be remote, but definitely big towns are not remote areas, isn't it? So what is so peculiar about it is that remote areas, uh, reaching there, getting all the facilities, managing over there becomes that much more challenging, more difficult. So that's why special emphasis on it. And disasters many times happen in remote areas also. Uh, Now, then we spoke of education and training is a very important part of disaster management as such. And when we talk under health, what is specific for it? Then disaster site management. Now, what did we? What do you understand by disaster site management? What is a disaster site? Of simple. Anybody? What is disaster site?
That is the
Yeah, that
location
is yeah,
where
that is
disaster occur. The,
Okay, Adamo, you say. Then
it is a specific location, a place where the disaster have occurred. That is a disaster site.
and Duma, what do you want to say?
yeah. I was just to say the same thing. It's just the area where the disaster has occurred, or yes,
Okay,
or the locality. Yes.
yeah. So site basically means where the incident happened and or where the disaster happened. But in medical, when we are looking at from the disaster medicine point of view, that is the medical uh, intervention for disaster. So that uh, is of we divide the area into two, isn't it? For disaster medical, disaster medicine. or medical management of disasters, or the medical intervention of disaster. So what are these two? Anybody?
The peri-hospital and hospital
One is the site, and one is the
offsite.
clinic, where we talk of the hospital or the clinical casualty management. Because at the disaster site, it is not a clinical area, you know. So clinical area, you will require a hospital, basically all the facilities of a hospital. So that cannot be created, just created. Yes, you can have a field hospital, you know, but then again, it is not very common to have or have many field hospitals. Okay. Uh, and a field hospital would be near the disaster site, but again, it's a temporary thing. Like uh, the casualties which were there during this February earthquake in Turkey, uh, may at the site management was when you are responding to disaster over there, and when the response phase is over, or the casualties are shifted, search, rescue, all these things are over, and but the uh, hospitals would still be involved in disaster management or the casualty management of the disaster victims. Some of them may still be under treatment, isn't it? So they will have to be in the hospital. So that is what we were talking of. So today we will start with this. Um, okay. So what is done here for the casualty management? So what is the specific thing for, yeah, clinical casualty management? What, what do you think should be done? Anybody? What will be the key focus? Hmm. Let's say, what will be the major things which the hospital will do for disaster, after a disaster, or for a disaster? Anybody? Yeah, Abdullah Suleiman. Yeah. Okay. Adamu, you want to say something?
Yeah, it is expected that each and every hospital have their own disaster management plan.
Okay, very good.
So,
First thing.
so it is expected when disaster occur, the trigger also should be pulled at the hospital to activate all those staff that were trained and the facilities store for that, and all the administrative and other cadres should be up and doing, and also to create their own triage area apart from that of accident and emergency, to enable them sort and also admit patient based on the severity of their condition and give them appropriate and adequate medical care.
Yeah. Okay, good. So this is what we are going to cover in this unit. So very well brought out by you. Um, so now, hospital is defined. What is the definition? It's firstly a residential establishment. So it provides short-term and long-term medical care. So this medical care will consist of observation, diagnostic, therapeutic, and rehabilitation services for persons suffering or suspected to be suffering from a disease or an injury. So this is what a hospital is. All these things, and these are Hospitals are very important in the disaster management because one of the main definition of disaster is that you will have a lot of loss, injuries to the people. So naturally, there's no other way but the hospitals are required for that. So all these hospitals, they should be alerted. The list should be prepared. Then, uh, in a systematic manner, the casualties should be sent to them. So also the specializations, capability of handling, all this has to be identified before only, so that patients are sent appropriately and they are given quick treatment, clinical care. And now let us look at clinical casualty management, um, or in hospital um activities. So this clinical casualty management will start the activities when, as you said, alert call is given, and every hospital gets involved, which is within the reach of the disaster, and depending also on the size of the disaster. And sometimes for bigger disasters, you may have to send the patients to the far off also, because these near hospitals will get full of casualties or overloaded with patients. So the disaster victims will be coming. So then they can be shifted also further off. Now, first thing is, uh, first step would be hospital alerting and response. So alert is given. So all medical paramilitary staff is alerted and they assemble in the hospital casualty. So first thing is activating and full staff being there. Then the casualty area expanded, because whatever may be the casualty area, if it's a big disaster, you will expect large number of casualties, and that maybe has to be casualty. All the patients who are coming from disaster site brought to the casualty area in the hospital. So now the main OPD area, they could be converted to receive casualties also, and it will require arrangement or in the accommodation for converting them whichever area into increasing the wards, rooms. All these could be used, uh, and also discharging some of the older patients who are there, some, because who may be getting better, so they can go home for further treatment or rest and other things. Those who can be sent from there, or maybe in anticipation, these patients are shifted from there to hospitals further off, so that the nearby hospital, the beds are vacant and new casualties from the disaster site are transported here. Okay, along with it, you will also operationalize all the operation theaters. That is also, normal time, some operation theaters are kept under, say, minor repair or not functioning, or you don't require so many operation theaters, or maybe during daytime you have more operation theaters, other times you don't. Then some operation theaters are next to the wards for smaller functions. So there are many types of operation theaters, or some are meant for certain, say, serious or long term surgeries, like um, uh, lungs or part removal, kidneys and other part replacement. And so they are specialized. So these could also, because these type of sometimes operations, normal operations can be postponed. So rearranging of all those things was also done uh, of older patients, if possible, and so that maximum space is created and for receiving in casualty section is improved, or reception casualty reception area is increased, and more staff is required, then more wards are there required, more operation theaters are required, or more critical care facilities are required, ICUs, intensive care units are expanded, or something like that. Uh, then the district hospital, uh, they will also open a disaster ward. There- and there's a concept of crisis expansion. So this should be implemented by the hospitals. Now, if within the hospital the space is not enough, then maybe nearby community halls, schools, other things, even during pandemic, even hotels were converted into hospital wards. So uh, means anything like that there. Another thing next, I think, would be security arrangements by hospital security staff with the help of police would be required to be uh, taken into consideration. Uh, Security is required because security staff, they guide also. See, if you see now, uh, this security staff becomes very important these days. A lot of crowd comes, onlookers come, relatives come, even the patients who are coming, so they will lend a helping hand. Yes, they have to be taken out from the ambulance, let's say. So you require a little more, two more people. So they are standing there, they can help in just taking it out. And they have, because they may be trained also into these things, as it is there on the job, they have been there, so they would be knowing these things. Then managing and controlling the people, directing them where to go and where not to go. Some like operation theaters, critical care areas. You don't want unnecessary people accompanying or coming, visitors coming, or their families. So separate areas could be earmarked for that. Then now all these, uh, they will be able to guide the security arrangements, and police also may be required. So control traffic has to be controlled, vehicles parked, ambulances separate, giving priority to the hospital vehicles. So all this has to. Next step is the management of casualties. So what do you do? Principle of triage is used for classifying casualty on need basis and treatment required. Then some people or casualties are brought in dead, or while they are brought in the casualty area, the resuscitation is carried out, they may die. So they are shifted to temporary morgue as there will be large number of deaths. So, so temporary morgues has to be established if required. So they have to be uh, dead, have to be kept separate. They have to be kept with proper dignity and honor. They can't be just thrown away. Dead bodies can't be just thrown away or piled up. So with proper dignity and other things. So, and keeping them in a separate area which is not visible or not to the public as such, or it's a separate area. All these things have to be done. Then diagnostic services are very laboratory, radiology, imaging services. So they have to be fully operationalized. Maybe additional help is required. So private services and all can also be incorporated. Emergency light arrangements, electricity generators, uh, then for uh, casualty areas, for blood bank, for X-ray department, for laboratories, for operation theaters. So um, standby generators would be useful, because addition not only giving a power backup if there's some problem with the main lights or electricity. So this could be there. And naturally, for all the machinery, other things to operate, you require the electricity, oxygen, everything else has to pumped, cooling, air conditioning, refrigeration for keeping medicines and other things. Maybe cooking also is done by electricity someplace. So all this. Then emergency light arrangement is required. Then communication. Uh, Whatever communication is there, and then it has to be strengthened also by additional means. Maybe wireless sets, radio communication, satellite phones could be used. Even temporary telephone lines can be laid. In fact, the services of army is capable of laying these lines. They use it in their field work. So this could also, so many things can be done here. Then support and utilities services, they are all to be alerted. Engineering department, they have to, they all the support service also have to be activated with day and night. They have to work to ensure water, the uninterrupted supply of water, electricity, power, and whatever may be required. Then medical supplies, medicines, drugs, non-drugs means other. They have to be supplied. Stocks have to be maintained. They may have to do some spot purchase, also get it immediately. All this has to be done. Blood bank services. Uh, so there could be voluntarily organizations arranged and volunteers arranged for blood, because there would be a requirement of blood. So you can have blood donation, donors list, and other things who can be called at that time. All, of course, there would be some stocks of blood, plasma, things. Public relations and information service, another key point everywhere. In fact, PR, public relations, and providing information. So, um, firstly, everywhere, wherever you want to have these type of things, you require public relations. So you have a nodal officer, public press officer, whatever you may call him, public relations officer or information officer. So this could be there, under whom all this information, he will deal with the public, the press, the radio, uh, maybe these days giving out on their social media sites, Facebook, Twitter, other handles, and giving information on what is relevant for the general public also. And all. Now, it is not hospitals, people should not get involved into um, giving information, only this nodal person. So he will be giving accurate information, what is required, and the hospital staff would be free to do their own functions. So handling information, media, and avoiding rumors, panic, all these are important issues. Then discharge procedures after treatment of the casualties who are fit should be sent home. So some can be discharged immediately after minor treatment. Some would require time. Some have to be discharged, and then later on by they can go and recover if it is appropriate home, if possible, and they can come later for further treatment. So after, so all these are aspects. So next thing, hospital triage. Now, triage we have covered earlier. I think you are all familiar, but let's go through it. Yeah. So this is the process when the casualties of disasters are brought in, they are sorted out, they are sorted, prioritized, and distributed. Three things are done: sorting, prioritizing, distributing as per the requirement for clinical care, so that um, proper clinical care to maximum number of casualties is given. So it is the need for optimum utilization of resources and the available services. Now, objective is to minimize death and disability. So there is a twofold goal of triage. One is to select those patients in greatest need to medical attention and to arrange for their treatment. So select the patients with maximum need for medical attention. And second is to ensure that the patient goes for treatment only to the appropriate and also forewarned medical facility. The medical facility already is ready for it to be received also. Goes to the correct place and they are also ready to receive it. Because there is always a shortage, limited personal and supply of resources. These medical. So for triage, a senior doctor is required who has experience. So um, when there is a heavy load of casualties coming, so there four teams are required, each having one general surgeon, one orthopedic surgeon, one physician, one anesthetist, two staff nurses, nursing attendants, and one uh, sweeper or cleaner who cleans the area. So, and two teams of stretcher bearers, each having a stretcher and two stretcher bearers. Each team of stretcher bearers consists of two-person with one stretcher. So, two stretchers with teams. So, this should be like this. There should be four teams so that they all are there for immediate triage. So, medical terms triage means sorting out and classifying casualties. So casualties are into three categories: priority 1, priority 2, and priority 3. Priority 1 are critical and severely ill who will need immediate resuscitation and life and limb saving surgery in 6 hours. If his surgery can wait for 2 days, then he doesn't come into priority 1. So immediate resuscitation and save life and limb saving surgery within 6 hours. Then priority 2, moderately ill who require resuscitation and early surgery within the next 24 hours. So they will come in the, and priority 3 are with minor illness and injuries. So, so basically these are patients with severe shock, moribund patients. So they could be priority 3, as their chances of medical deterioration, or help medically, immediate help requirement is not there. And you all know the color code tagging: red, yellow, blue, and black. So red is for serious patients, yellow is for moderately serious, blue is for patients requiring only observation, and so maybe priority 3 ones are blue, priority 1 and 2 maybe red, yellow, so like that, and black for the dead. Yeah, Damu, you want to ask something?
Yes, I just want to add something because
Good.
of some of our colleagues that are not from medical background,
Yeah, yeah.
that they should also know that this color coding sometimes differ based on the country. So in
Yes,
some
you're right.
in some
This is just a suggested coding which generally people are following, but it could be different all different places.
Yes, but mostly as it is here, it is red, yellow. But you will see this for patient requiring observation. You will see green in most of the countries.
Okay, here it is
Instead
blue,
of this
blue
blue,
could
you
be
will see
green.
green. Yes.
That is, I think, immaterial. As long as you have followed it, you have put it in your SOP, you are doing it, so that is good. You have the cards printed earlier, so stock of those are there in that type. So very good. Yeah. Uh, See, people who are into um, medical services would have a good idea of all these things. But now we are trying to take their help to relate it in a disaster. So in disaster management, we are always talking of pre-disaster, post-disaster. Pre-disaster is the preparedness, training, education, SOPs, rehearsals, coordination, having stocks, warehousing. All these things would come in the pre, because these things, once a disaster strike immediately, then you don't go into education, you don't go into creating new warehouse at that time. Yes, temporary field warehouse, something, if it is not that, you find some shortcoming still. But then that means the plans have not been made well, they have not been rehearsed, there have been no exercises carried out as per the plan. A plan is useless actually if it is written down, put in a book, very nicely written, typed, bound, and kept in lock and key. No, then it is a useless plan. Plan has to be, everybody should know about it. Then they should carry out rehearsals about it. They should have exercises about the plan. Everybody should know it, and new people when they come, they should also know. Periodic exercises have to be there, and from these exercises, these rehearsals, these mock drills, you learn things. So the plan, you find some lacuna in the plan or in your SOP, so you amend it and improve it. You may find the distances, the transport is not available, ambulance has already gone to get normal patients, or sometimes some ambulances are being misused. It's very common, you find. The staff is using the ambulance for, because there's shortage of transport, so they're using it as a transport. So these things are not correct. So naturally, so if such things are happening, it is a shortfall. Okay, good. No. Now let's look at clinical care. So two procedures are important. One is the resuscitation if required, and then is the treatment. Resuscitation and treatment. Now resuscitation is as per the laid down protocols. So these are for individual patients. Uh, they are treated as per this protocol in the emergency department or casualty. Some hospitals call it casualties, many it called emergency department, so whatever it may be, because the critical or victims or some, they are straight away brought here. It is different from OPD department. So in disaster, it is not, OPD is not relevant, then it is this emergency or casualty section or casualty department is. So resuscitation cannot be applied to mass in a mass manner. Means there are a lot of this thing. Everybody cannot be given at the same time because they have very limited resources. You know, so if there suddenly in an earthquake there are thousands of people who are injured, so that's where now the triage, other things we have covered. So resuscitation is not that 100 people at a time will be given. You know, it depends. So we are having four triage teams we suggested. So four patients could be given at a time, maybe. So it is all, of course, depending on the medical uh, advice, medical systems are prevalent in that hospital. Bigger hospital, naturally, more will be given. Smaller hospitals, it will be less. So after a disaster, the medical needs become overwhelmed. Lot of it is required uh, as compared to the availability of these facilities. Now, so resuscitation is identified after the triage is given, after is done to the patients. So resuscitation should be given top priority. So now resuscitation are there to select the patients whose lives have to be saved immediately, those who are in very much danger. So resuscitation, you apply the ABC model. What that is the activities that are carried out. So your those who are involved in the medical profession will have a very good idea. But so what is this? Patients are, yes, um, yeah, Adam Osman.
Yes, I just want to make some clarification on this ABC model. Hello?
Yeah, yeah, please come.
Yes, initially it was ABC, but in 2015 the American Heart Association have reviewed it to become a CAB, that is CAP,
Yeah.
that is circulation first, then airway, then breathing.
Hmm.
So this is the new practice, this is the new concept. It is now CAP instead of ABC.
Okay, that's you are right. Uh, there are variations on these things, but it is suffice to say over here that these protocol systems which are in vogue, they have to be implemented at this stage. After triage and resuscitation is important. Then one method was this, like even in triage, we are given one method of color coding, of the or the prioritization. So you are right. Uh, you know, um, what is code red? Have you heard of code red? Yeah. Anybody has heard of code, CODE, code red?
Um, y- yes, sir. When I was with a Nigerian Air Force hospital, when they say code red, that is mean it is very emergency. That is something is serious.
Yeah.
Code red, that is mean they need
So
to
what other
act
codes are there?
immediately. Sir,
What other code red is there? Other codes
I don't understand you, sir.
like code red is there. There are other color codes also. So
Okay, you are
basic,
referring to the color red, code red for
yeah.
triage. It means the
Not
patient
triage.
is
I
serious.
am not talking about triage. See, these are indicators. All these like triage or prioritization, coloring, red, yellow, blue, green, or blue or green, and then black. It's a indicator, so that everybody. Similarly, there is in an organization for safety management, you have these SOPs are there. These are signals. So it is just say code red or code yellow, or code orange. In a hospital, when the code red is sounded, that means it is the highest state of emergency. That means something has happened in the hospital, very serious, and there are SOPs laid down. So everybody will go and collect there, something like that. Another thing, code orange is when say code red is when some emergency happens. Let's say fire has happened, so everybody has to evacuate, isn't it? Of course, with fire you also have fire drills. But what in a hospital, if the fire happens in the hospital? So if a child is lost, missing in a hospital, code orange may be there. It could be different in different hospitals, but generally these five, six codes are there. So like that, these are what I want to tell you, that these color codes and these varieties and these things are a system of management, so that at that time you don't waste time in explaining what has happened. It's already fixed earlier. So because let's say in a hospital a child is kidnapped, a lot of kidnapping happens for children. Abduction can happen in a hospital, bigger hospitals. So at that time, then all the gates are closed. Nobody is allowed to move. The security, all of them, they come and start looking. So then it is announced the person where to get some security supervisor, or these people will collect additional security, people will come, or the other staff will join them. Then the key person will tell them what has happened, what type of a child has lost, so that immediately some sort of a crime is taking place, something like that. So these are symbolic symbols for immediate alert. So these are the trigger points, you can say. So similarly, like this, very good. We have to understand these things. To have these, that's why SOPs are laid down, plans are made. Plans would have SOPs as part of it, as annexures or this thing. So, and then detailed plans for each, say, casualty or emergency would have, say, separate detailed plan also. In addition to that, each person's duty may be there. What will the security person do? What will be the ambulance person do? What will be the stretcher bearer do? The nurse do? So all that plans. So these are very detailed planning is required. Um, Planning is a very, very detailed thing, and planning is everybody has to do his own planning and then merge it with the higher and lower level plan. Now, next is the treatment of different injuries or diseases. So, in mass casualties, when they're reaching the hospital, so there will be requirement of lot of medical help is required. You and Now, at the first aid or the disaster site itself, simple dressing would be done. People are injured and other things, so there will be some bandage and other things, or something simply is antiseptic applied, maybe morphine given, maybe painkiller, maybe. So all these things may be done, but then so it starts from there itself, the treatment, then management of wound. This is common in disasters, and many patients would be requiring. So the nursing staff dealing with these requirements. These would be simple requirements, but then a lot of people would have wounds. So such as bleeding has to be stopped, and dressing the wound. Then some injection painkillers to be given, and now let's say in patients have suffered crush. That means during earthquake they have been crushed under the debris, or building collapse in cyclone or something. So they will require IV fluid, painkillers, and management of wounds and fractures. So all this. So different types of treatments which will be required. So they have to be prepared and think in advance. So like that, dislocations, and these could be, corrected uh, as early as possible. Then managing fractures. Fractures can be deferred by a few hours. So, but it could be supported by splints, immobilizing that fracture area and giving painkillers. So, uh, children may be involved, so their special care is given. They being more weak and all, they may be prone to hypothermia. That means getting cold. So maintaining their body temperatures, lot of keeping them warm, and drugs have to be adjusted. IV fluids also very carefully, because different the size of children, different age of children will require different quantity of medicine also. Some so that has to be adjusted individually. So doctors would be able to do that who are there. Now, those who have received severe burns, so their management is also different. Painkillers are required, IV fluids, burn dressing is important, and respiratory burns, the patient should be prioritized for treatment. Mass burn casualties could be there, so they are very big administrative problem also because the burn victims, especially third degree burns, which are there would be there, a large number would come. So the resources may not be that adequate, and they require all these medicines, burn dressings, other things. Now, burn units, as it is in the hospitals, are fully, all the beds are, the ward is full generally. So old patients need to be transferred, and they transferring them would be very difficult. The burn patients are already there. So their load in the burn department increases. So a centralized emergency burn unit should be functional, where next maximum number of these victims could be managed. So principles to prepare hospital for disasters. So decide priorities and prepare for receiving about 100 to 100 patients. Take the collectors, that is the district head, permission for sample post-mortem. You know, um, because there'll be a lot of deaths in a disaster. Legally, or every death has a post-mortem has to be done. So here, earlier permission can be taken for there is a provision in the law. You in such cases you do sample post-mortem. That means of you, and all there are 100 dead bodies for the same this thing. So you do only of sample and then record that this is the cause. These are legally, it's a very important thing to do post-mortem. Don't assume anything and use color code. Do not send teams from the hospitals, but organize hospitals to receive casualties and manage them. And then take simultaneous actions. Everybody, all departments, they are working simultaneously. So all actions are being taken simultaneously. And triage, triage you are not doing only for patients, but also like vehicles, drugs, other things, everything you are doing the triage. That means they also are being prioritized. And another thing, just 1 minute, we'll just try to complete this, then I'll come to you. So documentation is the last part, but very important part in the hospital management, disaster management at the hospital stage. In fact, for all patient, documentation is there. Uh, in the army, what they do when they're during war, there are large casualties in a particular situation. So the casualties have to be evacuated. Similarly, in disaster, also from the side, they have to be taken out towards the hospital. So, and the patient cannot talk. Most of the time he'll be suffering from pain or unconscious, under respiration, with maybe oxygen, other things. So, like these cards are there, triage cards, green, yellow, red, and uh, along with it could be a small folder, you know, where the diagnosis, treatment being given at various stages, at the site when the comes out and taken to a medical aid post nearby. So he will write what has been given, say morphine, painkiller, some other medicine, drugs, injections given. So it is written on that, and that there's a card document. So that card is tied to the patient, maybe to his, if his, leg is broken and it has been immobilized with a splint. You know, generally a stick or something is tied around it so that the leg is one more. So to that you can tie this card also. So like that documentation starts from there, so that wherever he goes, the card goes with him, and the doctor over there can read what all has been done. So that is one also. And now, so patient's identification is written, his name, his address, whatever is available. If it is available, it is also written on that, so that this is not done again and again, and the patient may not be in condition to speak. And there is no family or other person with him in such situations. So rapid labeling followed by identifying patients. So a serial number is given always, even in a normal OPD or hospital admitted, you have a hospital identification number like that. So this is numbers he's identified. So this tag can be put to his wrist. Registration number can also be written on the by MC paint or GV paint on the patient's body. These medical some paints are there, but these days they are having plastic bands. They put it on your wrist and with the name, number, ID, and the card is along with it. So these days, so medical legal aspects for disaster response, they would include both the patients and the staff. So documentation, because some, there could be some criminal or the element also involved with this. So it has to be very careful. Then which staff is on duty, what time, all these have to be done, so that later on, if it has to be there's some medical legal case, the records are available. Injuries and related treatment is also written. Yeah. Yeah. You want to ask something, anybody? So now we have covered these as on the clinical casualty management. So this is one of the uh, site management and casualty management actually is the crux of the um, action of medical action at disaster. Anybody wants to ask anything? Okay. So let's have a short break. I'll just come. Okay. Yeah. So now we can start again. Yes. Okay, good. So next unit we want to take is unit 10 is the community health management. Now, community health is related to hygiene and sanitation and the food and water, one of the main important things. So, along with communicable diseases, appropriately about all these. In fact, we had covered in earlier courses on these aspects also, each of these. So, those things only which are there. Yeah. Yeah, you want to say something? Yeah, yeah. Yeah, yeah, Ibrahim. Oh, yeah, yeah, Ibrahim. You want to say something? Uh, okay, good. Yeah, you can keep your mic mute. Otherwise, so now community we have all been talking about earlier. Um, I think Yaya Ibrahim, can you listen? Hear me? No. So can you mute yourself? No, no, no. Okay. So community is an administrative unit of a country that is small enough to be able to identify its own leader and large enough to control its own resources. So uh, this is a social group determined by geographical boundaries and or common values and interests. The members know each other, interact with each other. So we all know, yeah, whenever uh, now this functions as a social structure and has some norms, values, and institutions. So, in, a individual belongs to a society through his family and community. So you can say community is bigger than a family and smaller than a society. So the community is the first affected, and they become vulnerable, they become weak, so they have to be, uh, a special focus is there, and they are the ones who can themselves also do something. So they, if they are well prepared, so naturally the impact of disasters would be less. Now, now, community is affected by the disasters, their health of the community because of the communicable diseases, unhygienic conditions, inadequate contaminated food and water. All these could affect them, and the health conditions become further worsen. So the medical and health services also get more affected by this. So if they don't, the communities they don't get affected much by, or their health is not affected, so their the health services would be free for other uh, jobs. Now, community health management. So it is the everything included in it for health needs of the community. So for the needs of the people, resources available, or everything is taken into account. So what is required is improvement of water supply, immunization, health education, control of specific diseases whichever are prevalent at that time or are likely to be, and health legislation. So what all community health management should do is effectively utilize all available sources. Is important. Involve people in the community and coordinate with other agencies. Now, now, how does disaster affects the community? Affects them in three ways. Disruption of the physical system. The physical system means the water, air, soil, housing, waste management, all those things. Second is the disruption of the biological system, such as the plants, animal life, bacteria, viruses, insects, rodents, all. And third is the disruption of the social setup, so occupation, income, religious, like that, other things, social. So these three components are to be managed. So this is basics to community health management. So let's see the important things which are uh, safe drinking water, control of communicable diseases, maintenance of hygiene and sanitation, and food safety measures. So safe drinking water. Water is the basic thing everybody requires, and so it is a vital thing, and there can be no life without water. But also, a lot of diseases and ill health are also due to consumption of polluted water. So water should be free from contamination, should be safe, easily available, and adequate quantities. Now, so water should be, what do you mean by safe and water for human beings? It should be free from pathogenic agents and other microbes, free from harmful chemical substances, should be taste should be good, free from color and odor, and usable for domestic purposes. So it is contaminated or polluted. So if it does not fulfill these up four conditions that we mentioned. So in disaster management, one of the vital thing would be providing safe drinking water to the affected people and also to those who come there as responders and rescue workers. So quality of water has to be ensured. Now, various methods of treatment of water, you can uh, so the administration, they can do any of the methods like pre-treatment of water. So now water in the lakes and or reservoirs are get exposed to the sun. So where it gets clean, sedimentation, because it is stored in the reservoirs and lakes, so the sedimentation also takes place. The quality of water improves, harmful bacteria and pathogens can get destroyed, and level of ammonia in the water also gets reduced in these places. So sedimentation is aided with coagulation, like chemicals like aluminum sulfate, ferric or ferrous sulfate, and ferric chloride are used to remove impurities, suspended impurity. And so once these chemicals are removed, so the mud particles inside their size increases, so they become fluorochlorated particles. So when these are mixed with these chemical, they become gelatinous precipitate called flock. And flock confines the mud particle and other things, collides. colloidal matter. So gets so the turbidity, these pathogens, they get removed from there, and this coagulated water is then passed through the sedimentation tanks that help to remove the fluorocated particles after proper settlement. So these particles which are inside, they get removed by sedimentation. So the other method is filtration. So filtration through granular material like sand, which get rid of color, odor, turbidity, and some pathogens. And then is carried out disinfection after that. So some disinfection infectant like chlorine is added to the water. So small amounts are put to eliminate later contamination also, so that the further when the water is moving from there to the so to where people will use, so some chlorine additional should be put. So in addition to that, boiling of water or treatment with lime, ozone, iodine and bromide, ultraviolet rays, potassium permanganate also disinfects water. So these are methods used at various stages or various types. It depends what quantity is being used. So it depends on all those. So the administration, local administration, its responsibilities for filtration, purification of water. Civic authorities, they have this water gets test. They test the waters. So so guidelines for drinking water quality is that firstly, water should be clear and have no color or odor. Taste and odor may develop during storage, but it should be checked then for contamination. So it should be tested for inorganic constituents, ammonia, hydrogen sulfide, sulfates, etc. Then microbiological indicators to check the presence of bacteria, virus, and other organisms. Then chemical constitution of water. So there can be risk from toxic chemicals. So due to contamination, pesticides and such things could be tested. Radiological aspects of water are also risk of ionizing radiation. So avoid radioactivity in water. It should be within the specified limits. So this is about the water. Then about control of communicable diseases. Now, now, especially during after a disaster, communicable diseases could. Sorry, the threat of these communicable diseases increases, and there's a possibility of an outbreak of epidemic. So, there must be your disaster management uh, should have good knowledge about these. So, pathogenic pathogenic agents which are caustic are like bacteria, virus, or parasites. So, you can also classify them as per the mode of transmission, like diseases transmitted by contact, scabies, trachoma, conjunctivitis. These are uh, trachoma and conjunctivitis of the eyes, scabies of the skin. Then disease transmitted by vectors are like malaria, yellow fever, meningitis, plague, and those transmitted through fecal matter. So, non-specific diarrhea, cholera, typhoid, amoebiasis, and hepatitis. So, diseases transported through air. These are acute respiratory infection tuberculosis, measles, meningitis. Then sexually transmitted diseases, gonorrhea, syphilis, AIDS, all these diseases one should know about them. Now, what are the factors that influence the impact of these communicable diseases? So, one is presence of new agent, pathogenic agent, increase in susceptibility of the population to disease like malnutrition, children, or vulnerable groups, increased transmission due to overcrowded and poor sanitation and hazardous living conditions in the camp. Insufficient water quantities deteriorates hygienic condition. And deterioration of health services to enable disease transmission at all levels because the vaccination may not be given or deterioration of vector control programs in disaster areas. So communicable diseases, disaster situation because of the inadequate disease control. So this there could be a spread of communicable diseases. So and this would increase the morbidity and mortality, more casualties, more suffering for the people. So what are the safety measures that can be taken? One is predictability. So determinants and distribution are diseases are known, then suitable intervention strategies are chalked out. So taking preparatory measures to counter these diseases. Hygiene and sanitation. So maintaining clean, hygienic environment and garbage control, vector control, proper and adequate disposal system for wastes, both solid and liquid, and use of insecticides. Community health education. So people are educated on the signs and symptoms, determinants, methods to deal with communicable diseases. So training can be imparted to disaster workers of the staff at different levels in the preparedness and response measures. So now, next thing important is hygiene and sanitation. So now contamination would occur through from person to person, fecal contamination of water and contamination of food. So these have to be controlled. So first is proper disposal of excreta. Human excreta should be so use temporary use latrines. So there are various types: shallow trench latrine, deep trench, pit latrine, borehole latrine. So these can be there. Then second thing is garbage control for community health management. So wherever the people are there, garbage continuously keeps gathering, and it's a breeding ground for communicable diseases. So vector control measures are important. So have garbage collection, transportation to dump area, waste disposal, try to burn maximum and bury the rest, and reuse or recycle. Then vector control. So this have problem during overcrowding, crowding, poor hygiene, insufficient water, poor sanitation, and sewage disposal. So these are favorable for uh, these disease vectors. So specific measures can be taken for vector control. Next thing is food safety. Now, yeah, yeah, you want to say something? Yeah, Ibrahim. Yeah.
No, no, sir. No, sir.
Okay. Okay. Thank you. No problem. So, food safety in post disaster. So food hygiene is important. So means that all conditions and measures that are necessary during the production, processing, storage, distribution, and preparation of food to ensure it is safe, sound, wholesome, and fit for human consumption. So this means that as a responder, food surveillance and food hygiene has to be taken care of by you. Then, because food is a potential source of infection, so all these stages has one has to be careful. So in bulk cooking, community kitchens, food hygiene is more important. Now, methods, measures that can include attention to preparation and protection of food, checking contamination of food items, prevention of flies and rodents, cleaning utensils properly, disposal of waste material properly, storage proper, and maintaining clean hygiene and sanitation. So we had covered on community health management. Anyone wants to ask anything on this topic? Otherwise, medical health and response to different disasters. We can cover the next unit. Yeah. Now, different disasters. Yes, Evristo, what do you,
Uh, I wanted to find out on water treatment.
what do
Uh,
you,
there are different methods there that you have clarified: sedimentation, aided by coagulation, filtration, and disinfection. Uh,
sedimentation? Yeah.
yes. These methods, does it mean water must pass through all the three for it to be safe for drinking, or one method can make it safe?
No, no, it's a systematic. See, we were talking. Yes, uh, Adamo Osman, you want to say? Um,
Yes, sir. Like
yeah.
what I have witnessed in the part of the country where I live, they have a ready-made solution in sachet, which can only be added into that water and it will make it safe. So it's not necessary that it will go through all those processes. I think it's UNICEF or who that made available those will I say a chemical or drugs? What okay, drugs are also chemicals. It is in powder form in sachet, so it's based on the quantity of the water. If you have 20 liters of water, then you add one sachet, and that will automatically purify that water. You allow it to stay for like 2 or 3 hours
Okay.
before use. So that
Yeah.
saves time, energy, and resources.
Okay. Good. So, if you would have noticed, when we spoke of sedimentation and all that process, okay, filtration and all, that was actually we had covered was that it is the duty of the local administration to provide safe water to the people. As it is the so and more also in the disaster situation. So what it was for, this was a process for water supply as such. You can't just fill tankers and bring dirty water. No. Um, so this is the normal process of water in an area when it comes. So this is the way it is done. That means if you are taking water from a river or any place, so first thing is it is stored somewhere. So in a lake or a pond or some water storage area, so its process starts from there. And this is the bulk water, because this is to be which comes in your taps, and ultimately it will come to you. What I think Adamo was talking of, yes, these are the water sterilization kits available. So, but this is only for, like he said, this is one sachet is for what is available there is for 20 liters. So there are many such systems are there. There is a tablets which come, small tablets. I remember we used to use long time back in army also. So wherever, so that tablet, one tablet is for 1 liter of water, and he rightly said in those there's a water sterilization for the emergency for little water. So you can't use that for the complete population. It is emergency. So you have those kits for immediately you want to get water. So you just take the water from the whatever is available nearby, some pond, river, and there, and then you can, or you can sterilize that with this. So another method of doing it is also boiling the water, but you can only do very small quantities. But the overall water that you need over a period of time for the community health, see, we are talking about community health. So you can't provide to say uh, the complete community like that. They can't survive on that only. In an emergency for short time, little bit, they, that is useful. So here we were covering as a part of community health over the after uh, this water sanitation, hygiene, food, all these points were important for health management of the community. So that system what we are covering is a bulk. It takes time. It takes few days actually for going through this process. First stage is that the sediment is stored, so stored for at least for some time, and this more than 21 day, so that the sunlight, other things, sedimentation takes place. Then you add these purification. Then it goes through sand. It goes through pebbles. There's a. It's made like that, and then sand is there, a different side, and all those things is what we spoke of. Okay, you are right. It is not, chlorination is done in the bulk over there. So you can use bleaching powder. You can use all these things. Even these sachets also. This is mainly chlorination. So you have to put that and then leave it for few hours, and still you will find some smell of chlorine coming in it. Some. So you have to leave it in the air open. So a lot of things has to be done. So good. Okay. Now, medical health response to different disasters. So we can quickly go through this. So, what is the response for earthquakes, cyclones, floods, and fires? Which four types of disasters we are covering here. So, all the case studies also had been done. So, we had seen that from them that all medical response was the most critical one in all disasters. So the health department, hospitals, health centers, nursing homes, NGOs, volunteers, community, international agencies, individuals, armed forces. So all of them provide immediate medical relief also and resuscitation to the affected. And then public health management of disasters also significant. So earlier one was unit we were covering was the public health management. Now, so here we are seeing in the response to disasters. So let's see in earthquakes. So what do you do? Education, training, simulation exercises for medical and health personnel. You are uh, doing the specific things. Then community awareness of do's and don'ts during and after an earthquake. Education and training for community in first aid, transportation, etc. How to remove the victims, other things. Identification of medical health services, medical camps, health centers, referral hospitals for people who are trapped, injured, and vulnerable. So at the response stage of, if we preparedness stage you are doing this, then response stage in earthquake, you first aid, triage, tagging of disaster victim, transportation of badly injured, provision of food, water, shelter, hygiene and sanitation has to be kept in mind. Need assessment of the affected, dissemination of public health information, and effective environment management and investigation and control of high incident diseases, cholera, gastroenteritis, measles. So These gastroenteritis diseases comes up in most of the disasters because of the poor sanitary conditions. Then psychological help to trauma victims. This also is an important part of health management. Then special emergency based support systems, life supporting first aid, advanced trauma life support, re- resuscitative surgery, field analgesia and anesthesia. That may be required in the field also for on the spot some resuscitation, this thing. Then resuscitative engineering and intensive care. So these are can be done in hospitals. Safe evacuation of injured to medical camps. So also evacuating patients, equipment from hospital, health centers, nursing home which have been damaged. So earthquakes, so these because earthquakes are generally widespread. So the hospital will also get damaged. So this is another problem which is peculiar to earthquake as such, because the area where it will be affected, the hospital medical services also will be affected. So then damage assessment for medical health infrastructure, then data and record collection for future research and documentation, then involving local community and volunteers in relief and response, and coordinating and communication with other agencies. So these are the things which are basic. Then in cyclones you will have infectious diseases and gastroenteritis, measles, skin infections, more because of the people getting trapped and blown away, and a drowning may be there. So various things. I think these are just repetitions of what we have done, because response phase generally is specific. Other preparedness is would be same in all, except focusing on that type of disaster also in detail. But response phase, you are responding with the medical teams. So vulnerable communities in this would be the fisher folks and coastal areas. So they have to be moved to in advance to safer places. Medical camps to be organized in those areas, and first aid should be ready. So when in case of any major injuries, and they can be sent to hospitals. Communication is required, and food, drinking water, or immunization, hygiene, sanitation is to be ensured. Vector control, garbage disposal, disposal of dead, disposal of carcasses. In cyclones, a lot of animals also die. Yeah, so their carcasses are there to be. Otherwise, if they keep lying for a few days, diseases would spread. Need assessment or damage assessment, psychological counseling, epidemiological studies, and community can assist in first aid and evacuation. So for floods, again, it may be due to river rising, inundation in coastal areas and towns. So there you can have river systems and all are damaging. So it could be due to damage of flood. So their disease injuries could be due to severity and duration of the flood, drowning, animal and snake bite, inadequate health care during evacuation and in shelters, damage to hospitals and health centers, shortage of food and drinking water, deterioration of hygiene and sanitation, lack of vector control, lack of preparedness measures against flood, inadequate measures of epidemic control, and delay in medical response, poor health conditions. So, to mitigate these, have a medical and health contingency plan. Train key medical, health, and administrative personnel for these specific things. prepare community through education, training, and simulation exercises, conduct epidemiological studies. Now, response, you know, so their evacuation protocol is set up immediately, and medical teams have to be assigned to provide immediate relief. Emergency medical centers at disaster sites, along with stocks and stores, to be set up, and safer areas. Safety of medical and health workers to be ensured. Coordination with local and national authorities, health agencies, NGOs, private institutions. An on-site reporting room should be set up. Site means that the place where disaster is there. So some reporting room to collect reports and monitor the situation. So this will also help in keeping a check on the outbreak of epidemics and regularly monitor health trends in the flood affected areas. Then controlling spread of diseases and safe environmental measures to be implemented, like immunization, vector control, garbage, and all that, disposal of dead. Delivering safe and clean water from government tankers, packed bottled waters, provide balanced diet, all these things. Distribution medicine and managing medical supplies, taking the badly injured to hospitals, mortuary services, disseminating information, conducting disease surveillance. So, in fires, what are the medical and health response? So, fires could be natural and other fires. So, natural fires could be associated with natural disasters like earthquake, volcanoes, lightning, and so fire. And then others could be with human recklessness, cooking, heating, faulty electrical gadgets, short circuits, bomb explosives, terrorists. So these could be. But when there's a fire, it has to be immediately controlled, and people, if trapped, are quickly evacuated to safe places. But if it's a massive one, there'll be great loss to life and property. So those connected. So we need to have a public health implications of fire disaster. So impact is the burn injuries due to flying burning objects, deaths caused by inhalation of the smoke, you know, because poisonous gases are there. People can die of carbon monoxide gases, asphyxia, then asthma, sinusitis, upper respiratory diseases, other things can be there. And so long-term disease due to burns could happen. Disfigurement, deformity, amputation, fractures also are there. And firefighters also can be affected by heart attacks, and psychological trauma is there for some. Vulnerable groups like children, elderly, sick, physically challenged, the effect would be more on them, and financial strain on the people. So response to fire is have a contingency plan, prepare that. So training in contingency plan being to the key medical, paramedical, and administrative staff, medical team fully equipped with resources, ambulance, logistic personnel to be able to immediately react and come to the aid. So fire brigade is the most important asset, but these are generally in cities. So they can also be there. Effective coordination, communication, transportation between disaster site and hospital medical centers. This is very critical because most of the victims would have to be taken to the hospital. Occupational safety health of the medical team and psychological and mental health experts should be provided to render advice and counseling. Medical team should coordinate with other agencies, NGOs, volunteers. So this is another thing about fire. Now, Another thing is the role of ICT, information communication technologies in healthcare. The, actually, all these things are already, we are covered them in other places, but here let us quickly go over them and understand what all is there in ICT. Okay, so what is ICT? What do you mean by it? So let's have a look. Now, ICT plays an important role in disaster management in catering to the varying health needs of the affected population with its tools and applications. So we must know about these. So I think ICT we have covered earlier also, but you are all clear in what it is. So every form of technology used to create, store, exchange, use information in various forms. Then could be in the business data, voice conversations, still images, motion pictures, multimedia presentation, and others. So see, now it is also using internet technologies and satellite imageries, radars, computers, sensors, cameras, and many other things for disseminating the information. So components of information technology are like remote sensing, satellite imagery, internet, geographical information system, mobile and satellite telephones. So these can be worked individually, combination, and handling the information that is there. So tools of ICT, we have covered again: GIS, remote sensing, satellite imagery, and internet. Now, GIS is a set of tools for collecting, storing, retrieving, transforming, and displaying spatial data from real world for particular set of purpose. So it's a system for capturing, storing, checking, integrating, manipulating, analyzing, and displaying data which are spatial reference to the Earth. So it is spatial, it is referral to Earth. So components are the component. GIS components would be, it requires a computer system, a software, and the spatial data and data management and analysis procedure. So spatial data is the geographical data, which is information about the position, connections with other features, details of non-spatial characters. Spatial data will include, say, longitude and latitude as a geographical reference, connection details such as service roads, railheads. It shows you, GIS will show you the main road, the service road, railheads, etc., that allows the outsider to access the areas. And non-spatial or non or attributable data such as details of amount of snow or rainfall also. So wind speed, direction, so that is a meteorological information also, could be another part. So GIS uses geographical positioning or location, so as a common thread to integrate and analyze information from various sources. So can be used to assess risk to life and property stemming from natural hazard like earthquakes, cyclones, tsunami, floods. So uses of GIS: studies of environmental hazards and disease clutters. So, a lot of studies on this in which this GIS data is used, and disease mapping and geographical correlation studies, patterns of health service use and access, for planning organizational issues of health service. So referral points of hospitals can be there, emergency clinic locations can be there on GIS, emergencies. So, and all these can be used. Then search and rescue, it can be used, GIS can be used for a very effective manner. It identifies the areas in the disaster prone, zoning them uh, according to risk magnitude, inventory, population and asset simulation, damage and scenarios. And record management. So keeping crucial task data, so status of repairs, repairs required personnel, and other things are maintained by GIS facilities, and also the status of ongoing work. So records also. So what are the damaged structures and how much work would be required. So all this also can be accessed. And next thing is remote sensing. Now this is another technology for sampling electromagnetic radiation to acquire and interpret non-immediate geospatial data from which to extract information about features, objects and classes on the Earth's land surface, oceans and atmosphere. So remote sensing is used. So it gathers data information about the physical world by detecting and measuring radiation particles and fields associated with objects located beyond the immediate vicinity of the sensor. So remote sensing includes a aerial remote sensing also, which is a process of recording information such as photographs and images. So sensors may be fitted on satellites or low-flying aircrafts, or it may be installed on the like ground also, like the radars. So it can obtain images of various kinds. So this remote sensing data may be recorded like photographs or digital form. So digital these days it is mostly being used in digital form so that it can be processed by computers. And if any digital data can be converted into photographic form. So how does it work? Remote sensors, they detect energy emitted or reflected by an object. So source of radiation can be sensed, and it may be independent of the sensing device. That means it is not since the device is not active. So active remote sensing are radars and direct radiation of a particle from towards an object and then detect the amount of that energy which is radiated back, like radars does. So that is the active remote sensing. Then there is passive remote sensing. It relies on radiation originating from some other source. So mainly it is the sun. So energy from the sun is coming and then reflected back. So that is uh, by remote sensing, it is picked up the information. So aerial photography, satellite imageries are the examples. So remote sensing you can use for land cover mapping, environmental mapping, traffic management, air pollution modeling, disaster management, pre, post, during. All these can be part of it. So it can be applied in health response after disasters. Is GIS and remote sensing. Okay. Satellite imageries are used. So satellite, everybody knows these are the some things mass which is orbiting a large body or mass. So when we speak of satellite, we relate them to say weather or these are man-made machines which orbit the Earth. So weather observation is there, which has been done, but there are other also. So in weather, so you get atmospheric data, cloud, storms, other weather, and you get a clear pattern of the situation of the. Next thing is internet. You are all using it, so it can it connect lots of computers, other devices for interacting between each other, for information sharing, and these are now integrated with remote sensing also, with GIS also. So all these are overlapping. Telemedicine is very interesting. A lot of work is done, or a lot of it is being done. Or it has advanced quite a bit. So it is basically investigation, monitoring, and management of patients, and also education of patient and staff using systems that allow access to expert advice and patient information. So the patient and the information person may be located very far away. Like you and me, we are there, so we are having tele-education. So similarly, telemedicine is also. So this is fast, cost-effective, and time-saving. Now, medical transcription, that's another thing that can be used by these technology. Satellite telephone communication systems, very useful. So these are some of the things we have covered. Now, anybody would like to ask anything about our, yeah, so what all we have been covering? Anything you want to ask? Role of ICT we covered now. So today, if you see, we covered from clinical casualty management, and then community health management. So where we spoke of the safe drinking water, control of communicable diseases, hygiene and sanitation, and food safety. This, after that was medical health response to different disasters. We could go through them. And in this one, on the role of ICT, where we spoke of GIS, remote sensing, satellite imagery, internet, and satellite telephone communications. So, anything you'd like to ask? Anybody? Any questions? Okay, Evristo. Yeah, please.
Thank you so much. It's a very informative lecture. My question is on the GIS and remote sensing. I've seen mainly there's a connection to disaster response, especially in the medical cycles. How can these help? These systems help, say, in disaster preparedness or disaster mitigation?
Okay. So your question is on remote sensing and GIS. How can they help in disaster management, mitigation and prevention? And okay, that is what your question is on. So, in fact, this on ICT we have been covering in every course, in response and rehabilitation, even in
Yes, I've
preparedness.
noticed. I've noticed actually, but I've seen that in the medical one and in the disaster medicine, I think the concentration of the topic is more on response side.
No, it is a preparedness. It starts in all stages. See, preparedness is on planning, education. If you remember, when we spoke earlier on the course on vulnerability, I think MPA 3, vulnerability analysis and other things, MPA. So, or risk assessment. Now, we did risk maps, disaster maps, uh, all those. Yes. So just 1 minute, Adamo. I'll tell you.
I think you're muted, Doc. We're not able to get you, Doc.
Hello? Hello?
And you have the
Hello, sir. We are not able to get you.
I know some problem is coming with my system. No. Can you hear me now?
We can hear you now.
Okay. So, yeah, Ramu, you want to say
Yes,
something?
yes, sir. With regards to his question, that he's asking about the
Yeah.
role of GIS and medical response. You see, in that medical response, we have the portion of evacuating victims from the site of disaster to hospital. And this GIS will also guide those drivers to a nearby health facilities or appropriate health facility that they can take the victims to in a very short time. And it also gives them options of route to where they can use to avoid crowd and traffic jams. And also with regards to sensors also, sometimes we are dealing with a man-made disaster like conflict and other things like that. So if those cars or aircraft are being a kind of build up with the sensors, it will assist them in noticing if there is mines or bombs that are being put on the road. It will sense it and give them the alert to avoid that route and things like that. Thank you.
Adamu, you're saying correct, but your last point about GIS detecting mines on the road, um, I don't think so. It can detect. Yes, if it is being marked as a mined area by people who have detected it earlier, but GIS cannot detect. Remote sensing, so far this technology has not come. India is doing a lot on this GIS and remote sensing. It has got its own satellites, and now latest is it is having its own GIS satellites also. So basically, GIS is geographical information systems, means anything on the land, the information you can get, and satellite is the one useful method. Whatever data, image, from the land. Also, land, clouds, air, atmosphere, water, all these data, all these can be monitored now with all this. So, uh, it is being used in so many ways. One is for disaster medicine planning. You are doing hospital plan, other things. You want routes, you want maps, and with that you can quickly develop new maps. Yes, you are right. Sensors can detect maps. Yeah. Mines, sensors, no, not GIS or detection of mines is a very different sort of thing. You have to have devices right next to it. It's a very dangerous job. So you have to be next to the mine, detectors which are there. Otherwise, it is done physically by prodding. You iron these small knife, or you can do it, or you can have some detection. Mine detectors are there. They are metal detectors. They are explosive detectors. So these are also there. But then it has to go over that land. It can't be done from far off by aerial photography or from satellites. because GIS would be from aerial somewhere, you know, either aircraft, balloons, maybe, but these are all mainly it is done by satellites. They have become very accurate. And so it is now GIS, all this technology is intermixed. Medicine, definitely there are applications also direct on medical aspects, I'll tell you, like telemedicine. Telemedicine for disaster is very useful. So, but it's not given your book, so I don't want to cover it in detail from the exam point of view. It is not there. But otherwise, yes, it's a lot of work is being done and it is being used. You know, you um, of course, immediately after the triage, you want specialists to diagnose and help in telling, or very senior doctors, so they can't be present all over. So from far off hospitals, they are telling the hospitals, smaller hospitals which are there, where there are specialists are not available, uh, GPs are there and other people are there. So complicated cases they can deduct your reports, your imageries, ultrasound reports, and uh, this MRIs and all can be transmitted to the doctors through the internet, through G. So all these, so remote sensing. Not only that, the location. So when you want routes like Adamu was saying for moving there, so you can have use these things. So these technologies can be used. A lot of things are there, and everybody cannot use it. Why? Because they are not trained for it. They are not educated enough on these things. So along with your own specialization, you have to learn a lot on these things. It's a naturally you can use a computer, but all these things are available on a computer. So it doesn't mean that you know computer, you know GIS also, isn't it? So you have to learn a lot on that. So people on geographical and space, the geographical information is there. So routing and all this. So now the data can be, you can have softwares. So using this data and using your documentation, let's say, is done. So you can, if you have handheld devices, small computers, where you feed in the data of the cover, this thing of the victim or something, like the triage cards are there, so they can be uploaded on this. And before the patient reaches, the data is there with the hospital. What type of patient coming, what is name, what the paramedic over there has said, who's evacuated, what is it. So it will help a lot. You can have a big screen in the hospital now in the control room, and there you will have all these data coming. So it will become very sophisticated things are happening on this. But it can't be everywhere because these are also costly things. So I think in a developing country, the cost is very big in disaster management. Why there are disasters also? You can't have very expensive things everywhere in a large abundance. Okay. Yeah. Anything else? Okay then. So if there's no more question, I think uh, we
I
can
think you have
close.
done justice to the questions.
Damu, what?
No, I have said I think you have really done justice to the questions.
Yeah, yeah, yeah,
So
yeah.
thank you very much.
Okay, okay then. Bye bye for today. Tomorrow again we will meet at this time for the fourth session.
Mhm. Thank you very
Okay,
much, sir. We
bye.
really appreciate. Bye.
Thank you.
Thank you very
Thank you.
much.
Till tomorrow.
Okay, guys, take care of yourself. Nice meeting you also today.
Thank you, Adamu. Till tomorrow.